Good afternoon, everyone, and welcome to WCCS Wheaton College Radio 96.5. I'm Adam Bass. Once again, we are continuing our coverage of the 4th District primary of Massachusetts. And joining me today is epidemiologist and candidate who has been in the news as of late, Natalia Linos. Welcome to the program, Ms. Linos.
Thank you so much, Adam, for having me.
So let's begin with something I actually want to talk about later on in the show, but I think it needs to be discussed now. Mainly due to the fact that I think our economy is starting to realize that this is happening. There is another outbreak of coronavirus, that has started to begin to spike in our country, most notably in 3 states, those being Florida, Texas, and Arizona. 3 of those states President Trump is going to rally in very soon. Now, it's clear that this virus is not going away. The market is now down 6% because of this realization. So as an epidemiologist, someone who studies these viruses and massive outbreaks, what I want to ask is, first of all, how do we continue now that these states are, A, not still following guidelines, and B, how does Massachusetts stay safe so that we don't have a second spike before the second wave comes?
Thanks so much, Adam, for that question. And, all epidemiologists right now are very focused on this idea of a second wave. I mean, we expect it until we have an adequate vaccine, until we have a treatment, we're not going to be safe. So what's happening right now in these states is, there's been a false narrative that's been presented between our economy and our health. And that we need to push back against. And we need to prioritize workers' health, especially low-income workers. I think the reality is that until we have, the technological solution, which is, enough testing, enough our ability to actually identify people who get sick, to support them into staying, isolated or in quarantine, until we have those mechanisms in place, we're all at risk. And we're reopening too soon. I think that is the consensus across the public health community. And we're not opening with those who are most at risk in mind. So it's a challenging time for Massachusetts itself. The plan by the governor, the 4 stages, saying that it's data-driven, that has the basis for a good beginning. But I do think that we need to be a little bit more careful around the inequities, who is most likely to be impacted, which communities. We see communities of color being particularly disproportionately impacted, as well, obviously, as the elderly in our nursing homes. What we do there will be important. So it is both concerning that we're seeing this spike in those 3 states, but it's not surprising.
So to play devil's advocate, there are some people, including one of your congressional rivals, Nick Matthew, who has not made it on the ballot, that are calling for a permanent lockdown of the entire state, an increased lockdown. The problem with that is that, and I've discussed this with other people, Americans are impatient. We are an impatient bunch. We feel like there's, as you said, a false equivalency of, it has to be locked down or it has to be unlocked. Can we find a middle ground in which we can still live on a daily basis life and yet keep the precautions in place, even if there's a vaccine created?
Yeah, so the public health folks call it a harm reduction strategy. Realistically, we're in this for at least 18 months to 2 years, and we're going to have to change a lot of the ways we interact with each other. I think everybody agrees that staying in lockdown as we have for the past few months is unsustainable and doesn't work. And it doesn't work for many people. It doesn't work for the homeless. It doesn't work for survivors of domestic violence. It doesn't work for parents like me with 3 little kids who are, it's hard. It's hard. So we do need to find new methods. We know that wearing a mask is very important. So I do expect that we will be seeing people wearing masks in the streets all the time. We're lucky that we're moving into the summer because outdoor transmission is much less, much harder. And we may need to be creative around a lot of the ways we do things, whether it is how we see our friends, it might be in public settings outside rather than in our homes. Like no more dinner parties in your house, but a nice picnic out in, a public park where you put down a large blanket, they put down a blanket and you sort of share a meal, but you don't actually share the food. There will be ways that we can continue to socialize in a way that is not risky. And I think we should be socializing. My biggest problem and my biggest worry, and one of the reasons I entered this race, is that I felt that we were losing our humanity through this fear, that fear was creating a sense of turning inwards. And, I'll tell you a story. I was driving down in Brookline, and there had been a man who had fallen, an elderly man in the street, and there were people watching him, and nobody was picking him up. And I think it was because there was fear that, does he have COVID? Does he not have COVID? And that was to me a sign of such a call for, like, we need to do better. This man is at immediate risk of being hit by a car or a bus. Nobody's helping him because they are so afraid. And we as public health professionals, at that moment, I realized we had failed the public. If we feel that we've created this sense of panic that nobody will help out an elderly man, so I got out, I helped him up, and he looked at me, he said, "I can't believe you helped me." And I said, "Of course I'm going to help you." Like an individual interaction, the risk of transmission is pretty low. But we as, public health community, we did a very, black and white. You stay in, you don't talk to anyone. And even people saying hello on the street, like, people are not saying hello because there's this kind of closing of everything. So I do think we need a new model because this is to stay.
It seems interesting because of all the candidates I've talked to, each one have called for a return to humanity, even in this crisis. Ben Siegel, he's focusing on criminal justice. Alan Casey, he's focusing on bringing people together through like a Peace Corps sort of service. Jake Auchincloss, bringing people together through non-traditional ways, since he can't canvass anymore. So let me ask you, through your campaign and through, if you become a congresswoman, where do you seek to put the humanity in the 4th district?
So there's a lot of ways, and I don't think there's a single, I like that you summarized their positions, because I think with me, it's not a single thing. As a parent of 3 little kids, I do feel that there is a shared humanity of, what parents are going through right now, and really understanding them and understanding our fears. Parents right now are scared about, if schools don't reopen, will our kids, I have a 7-year-old who is barely learning how to read. Like, what will this mean for her future if she doesn't learn how to read till she's 8 or till she's 9 because schools aren't there? Or for parents with kids with special needs, that's especially, challenging. For me, at this moment of, a racial awakening, that will be my priority. I've done a lot of work around racial justice, both on the research side, but also as a practitioner at the New York City Health Department. I think this is the moment for turning our country into a much more equitable country. So, if it was one thing, it would be around racial justice and the momentum that the George Floyd murder brought about. But I think it was because it was overlaid by some dark inequities that COVID also exposed. So that would be, a shared humanity around, we really need to do better. We need to talk about the racism and the structural racism that still exists in all our institutions, whether we're in academia, whether we're in politics, whether we're in the police, in all of them. So I think that would be a key part. But, I talk about humanity more as a way of, how do we engage with our neighbors? How do we lead with our values? And how do we lead with a moral agenda rather than just a political one?
Completely understandable on that front. I do want to move on to the George Floyd incident it wasn't an incident, it was a murder. I apologize. And our relationship with police forces. Now, you and 8 other candidates have signed on to the No Cop Donation Fund or pledge from the College Democrats of Massachusetts. The only candidate that really hasn't yet, as of late, is Chris Xanatos. I will try to see what I can do to reach out to him. But regardless, it seems to me that the Democratic Party and some parts of the Republican Party do see a need for police reform. Just recently, Kevin McCarthy, the head of the minority in the House of Representatives, has agreed for a ban on chokeholds. And as you know, the Democratic leadership in the House has called for a new sweeping legislation, calling for a ban on chokeholds, a new system for an oversight for police, a ban on military weaponry, for police, and this is all sponsored by Nancy Pelosi, several other Democratic leaders, including the Democratic nominee for President Joe Biden. Number one, do you agree with this legislation? If so, do you think there needs to be more that goes into it, less that goes into it? What would be your thing that you would add to it or even get rid of?
Sure. So you guessed right. I would add. I wouldn't get rid of. I think it doesn't go.
Yes.
It doesn't go far enough. I mean, I do think that, of course, it's necessary. Limiting the ways in which the police engage with individuals, whether it's getting rid of chokeholds or thinking about what sort of weaponry they're allowed to carry or not carry in certain situations. That's first step. But I think people are calling for a more systemic change, a systemic change to the institutions, thinking about over-policing and over-surveillance of communities. Some communities, I was doing an interview yesterday from a public health lens, and they asked, what would a public health response require? And police-involved deaths are not reported. There is no national database. We rely on the media, on the Counted or other kind of media in order, as public health experts, to really talk about it. But it is a public health issue. We need to know how people are dying and how many people are dying at the hands of the police in order to actually bring it to light and do something about it. Public health is around prevention. So, I would call for a national registry. Things like tuberculosis or COVID are reportable. So the minute something happens, the health department gets pinged in real time. This person has COVID. If we had the same, this person was injured by the police, or this person was, died at the hands of the police, whether it's murder or, it could have been accidental. But if we had a better accounting, that would be really helpful, both for media and accountability. There's also a lot that can be done around just limiting, the interactions, right? So the police are doing things, engaging with mentally ill or the homeless in ways that other parts of our government or other parts of our local, social workers, public health people would be much better suited. So I believe strongly in changing the role of the police when it's appropriate, and I think limiting inappropriate interactions. And I can give you an example. I worked at the New York City Health Department, and there were a lot of initiatives between the NYPD and the Department of Health around mental illness especially, and how to identify people who may be mentally ill but pose a threat to the public. And even the budget of those initiatives, these joint initiatives, the vast majority, 80% of the budget went to the police and 20% to the health department. Rethinking how we fund different types of initiatives, making sure that a social or civilian kind of approach is prioritized, I think is important.
It seems to me, and I think the rest of the media is starting to realize this, that despite what the president is saying, that Democrats want to defund the police, it doesn't seem to be the case. It seems to be, again, that false choice that he is talking about. Even Bernie Sanders, who's considered by many to be pretty left of the spectrum, is hesitant on saying defund the police. What I see, and I wonder if you agree with me, is that this is not the right slogan. It's something else. Joe Biden said it's reforming the police. Nancy Pelosi says it's reanalyzing the police. What for you, would it be in the police? Is it a reanalyzing? Is it a reforming? Is it a reconstruction of it?
Well, I was alluding to it before. I do think that the police is serving or trying to fill gaps that we identify. We have homeless people in the streets, or people who are being evicted, or people who are victims of violence, who the police is not serving them, and they're the point of contact. So rethinking the role of other actors. So I would actually shift the conversation, not from the police, but say, who is best placed to deal with a domestic abuse situation, or who is best placed to deal with the people who are homeless in the street, and a neighbor calls because they're irritated, but really we should be serving those people. So putting the people who we're hoping to serve first and thinking, what is the profile of that individual? Is it a social worker? Is it a health department person? Is it a different type of community group? And let's make sure that they are the ones who are given that role, and not the police. I think the police would agree sometimes that they're put in difficult situations where They feel like they are asked to be everything from, and so I don't know if it fits your one word, but it would be, making sure that the job that the police are doing is not actually better served or better done by someone else. And if it is, make sure that those budgets and those resources are given to those other individuals.
See, now that you mentioned that, this does give me the thought about how this could also help people with jobs, those who are supposed to be doing the jobs that are forcing the police. They're trying to do everything. So how would you, not enforce, but promote the jobs of the social workers, the mental health workers, those people who, as someone in the media, unfortunately leave behind in the shadows. So, and I believe it's a congressperson's job to elevate them. So what would you do to elevate these people who are not getting the attention that they deserve for the jobs that they are doing really well?
Well, I mean, there's a lot of ways. And, as I'm having conversations with people, I'm having conversations with nurses, I'm having conversations with social workers right now. I think my role as a congressperson would be really to listen first, to listen to the needs. Different communities across District 4 have varying needs, right? I've been talking to people in Fall River and Taunton, and where the opioid crisis is still a priority. We do need to make sure that we have people on the ground, and in parts of Brookline and Newton, the priorities might be different. And so first, as a congressperson, I would commit to be listening, and then to ensuring that the structures, whether it's local health departments or if it's small, community-based groups that are offering that they have enough resources, that they have enough, my ear. You can do a lot both through money, but also through context. And so that would be my commitment to just being there and ensuring that those individuals are given, working with unions, obviously, but also working with community-based organizations. So, yeah.
Impressive, I would have to say. So let's talk about the 4th District race, because there was a news piece that came out 7 days ago, that put you in the news. There was a poll release, the first poll that we ever got in District 4, thank God, and it showed Becky Grossman leading 13%, followed by both Jake Auchincloss and Jesse Marmel at 7%, Alan Casey, Ben Siegel at 4%, Dave Cavell at 1%, others at 1%, and undecided 60%. Your campaign noted that both you and Asani Leckie were not even offered as choices there. And this race is not given as much attention as what's going on, the presidential race and, of course, the primary with Kennedy and Markey. So I'd like to give you the floor to talk about this poll and to talk about what needs to be done to get people to listen about this race.
All right. Thanks so much, Adam. And, it was Becky's poll. It was her own team that put it out. It's not, and it was 500 people representative. What I had concerns with is that Becky's running on a platform about being a mom, right? She's a mom and she's bringing that sort of agenda to Congress. And she failed to include the only other 2 moms in the race. And I could understand if she didn't include me because I'm a newcomer. I joined the race in late April, right? But
Wow.
Hussein has been running for the longest, from what I understand. So yep. That seems like a bit of an oversight. What is exciting about the poll, though, Adam, is that Becky and Jesse were the top 2. I mean, yes, Jesse tied with Jake, but that to me is a sign that there is an appetite in District 4 for women. It's unfortunate that 2 of the 4 women were not included in the poll. I hope that won't happen again, in the sense that, not giving our names is of concern. But I do think that the key message was that this is an open race, completely open, 60% undecided, and such low numbers of, at 4%, 7%, like this can go in any way. And then optimistic about the possibility of a woman and a mother. I'm a mom of 3 little kids, and I wouldn't have always thought that that I should lead with that. I mean, I'm not leading with that because I'm an epidemiologist, and I'm leading with being a scientist and running at a time of a global pandemic with my science and technical expertise. But I'm also a mom, and I understand when Becky says, we're fierce, we multitask. We have been, especially through COVID, we are going through a lot as gender inequities are real, and working moms are pretty strong people.
If you win, or if any of the four other women win, and you would go up against either David Rosa or Julie Hall. If you go against Julie Hall, then the outcome is going to be, for the first time in Massachusetts court history, the first female congresswoman in this district.
Yes.
Are you ready to take up that task when that time comes?
Of course, Adam. And between us, I would be excited for any of the female candidates. I think it's time, and it's exciting to have 4 out of the 9, in the Democratic primary be women. I think it says a lot. Oftentimes people say, well, isn't that too many? You're racing against each other. No, we're racing together. The more women in a race, the more likely a woman is to win. And I am for all of them. They're all really smart, really competent. Any of us could do the job. We would all bring very different skills. I would do a job that would be probably much more centered around COVID and the reopening and response. I think I'd be much more active there, but they bring a lot of skills too. So I'm excited about that. And I hope the voters will put one of the 4 women in that position.
This is why I love this race. Everyone is so nice to each other. So to talk about more of the demographics of Massachusetts 4, I think it's clear that one of the big things about this race is that a lot of the candidates are from the northern half of the district. Brookline, Newton, a little bit of Needham, a little bit of Wellesley. There is not much of a focus on the chunk of Metro West, Ashland, Hopkinton, and the lower part, Fall River, Taunton, Norton, where Wheaton College is. And I feel as if there could be a disconnect. So what I'm going to ask you is basically, as someone who is a scientist and someone who puts their study of health and science beforehand, how do you reach out to those union blue-collar workers of Fall River, Taunton, of the southern region of Massachusetts?
Thanks, Adam, for that question. And it's true. We're all living, it's Brookline, the majority, then Newton and Wellesley. And it's and I think that says something to how expensive and how inaccessible campaigns are. That's something that has been, and I'll digress and then I'll answer your question. But I do think that that's important for your audience to know. Campaigns cost so much money. And in order to be able to run a campaign, you have to either be independently wealthy or have a tremendously strong network of very wealthy individuals. It is still, in the U.S. in 2020, should not be happening. We should not be only able to vote in people who either have deep pockets themselves or deep connections. So I do think that what we're seeing is just because people who don't have that access to resources are excluded, and we need to change that. That is something that, as someone who's new to the political race, it's been a painful wake-up call. People are saying you need to spend 10 hours a day calling to fund, on fundraising, and isn't that a shame? Shouldn't someone like me be really just talking to people like you, talking to the public, talking about my ideas and my policies? And I'm an epidemiologist at a time of COVID. Really, should I be calling people and asking for money? Is that the best use of my time? Or is it getting through what values and what policies I want to put forward? So that's an aside, but it's an important aside. I think that's why we're seeing this. And I wouldn't be surprised if that's the case in most congressional races, that you have the most well-educated or the wealthiest neighborhoods or communities, disproportionately represented in Congress. So that's a problem. Now, on your question of what I would do about it, I recognize that that's a problem, but I'm also an outsider in some ways. I don't have deep connections to every single politician in Brookline and Newton, which means that I don't need to always, they wouldn't be the first or only people who have access to me. So I've been talking to Representative Pat Haddad, who said, we've been left behind, and do you really truly believe in what you say in terms of inequalities and really wanting to meet the needs of those in our district who have not benefited as much as others? And that is my commitment. That has been my commitment for the last 15, 20 years, my entire adult life. I spent a number of years working at the United Nations, again, with a poverty and inequality lens. And so that is why I'm running. I am running to make sure that COVID does not widen our inequities. We already have very deep inequities across income lines, across racial lines. And COVID is the existential threat today. Climate change is the existential threat tomorrow. Both are important, just to say that. But if we don't really think about the needs of those who are recently been unemployed or were unemployed and been pushed into poverty, we're failing a big segment of our society. So for me, I live in Brookline, but that's not where I would be focusing my attention.
Two more questions before we go. The first is one I ask every single candidate, and that is the importance of a green future as well as a green economy. This is something that I think a lot of us in the 4th District believe in. It can come from transportation. It can come from how we do our jobs. What does a green economy look like to you?
So for me, I led the UN Development Program's portfolio on climate change and health. And so everything was through the lens of air pollution, around ensuring that individuals and families and children were not, it was an environmental justice lens. So my green economy would have a big environmental justice component, ensuring that new jobs, who's losing out in terms of, when we move to a green economy, what are people being displaced from their jobs? Are people being displaced from their homes? Are people being displaced? And how do we make sure we mitigate those impacts, ensuring that we invest in retraining? So my approach is less about one industry. I believe, if you look at my website, you'll see I have a policy in transportation. I have a policy of, I believe in offshore wind. I have strong beliefs on many issues, but I think the most important thing for me is an environmental justice dimension. We have to move to a green economy immediately. And I would be pushing for the COVID sort of investments that are, because COVID has led to such high levels of unemployment, I believe that there will be a push by the federal government for a lot of, creating new jobs. And these new jobs will be infrastructure jobs, but they can be green jobs. So I would make sure that we align those well. That would be a priority. But always thinking about which communities are not benefiting from any kind of federal program and making sure that they do.
And one more thing, sort of a final message you would give to our listeners about who you are and why you, of all people, running right now.
Thanks, Adam. So as I said, I'm an epidemiologist at a time of a global pandemic, but I've been working on equity issues and justice issues for the past 15 years. I've worked at the United Nations looking at how legislators, decide resolutions, from the Paris Accord to more minor ones. I've worked at the New York City Health Department on some of the top priorities, from the opioid crisis to mental health more broadly. I am a scientist, but I'm a doer, and I lead with my values. I'm entering this race because I think COVID is here to stay, and it could shape a future that is not one that we want. But the optimist in me believes that it could also shape a new future. And so if your audience wants to go to my website, it's nataliaforcongress.com, Natalia. I would love to have volunteers. I already have around 150 volunteers. There's a lot of momentum because I think people do want science in Congress, and that is not just for COVID, but for future pandemics, for addressing the climate crisis. Scientists matter, and there are only 11 right now. I have a deep commitment to our district and to the issues as a parent, as well as a resident, and to reducing the inequality. So I think if people believe that they want a fresh voice, a fresh perspective, and that a scientist and someone who has devoted their career to equity could bring that, then I would love their support.
Natalia Linos, thank you for joining us on WCCS Wheaton College Radio.
Thank you so much, Adam.
That's going to be it for today, everyone. Thank you for listening. I'm Adam Bass. Tune in for next week as we discuss our next discussion with Julie Hall, the Republican candidate for Congress. Thank you, and good afternoon.